Ever wondered how the current state of healthcare policy impacts your well-being? Let's take a moment to reflect on this. The year 2024 has seen a whirlwind of changes in healthcare policies at both state and federal levels. From the expansion of Medicaid to the prioritization of affordability and accessibility, the landscape of healthcare policy has been shaped by a dynamic mix of challenges and solutions. The beating heart of these policies lies in their profound influence on our individual health and the collective well-being of our communities. Now, more than ever, understanding these policies is crucial to navigating our healthcare system. We're living in an era marked by soaring healthcare costs and stark disparities in access to quality care. The ongoing COVID-19 pandemic has only added fuel to the fire, underscoring the urgent need for comprehensive and inclusive healthcare policies. States like Texas are making strides to reduce the number of uninsured residents, while New York is placing consumer protection at the forefront. Meanwhile, the federal government is making concerted efforts to make healthcare more affordable and accessible, with a particular emphasis on expanding coverage. Yet, challenges persist. Nearly 800,000 Floridians remain uninsured, despite efforts to expand Medicaid. Prescription drug prices continue to skyrocket, burdening those who rely on these medications for their well-being. But as we grapple with these issues, there's a light at the end of the tunnel. The 2024 healthcare policy presents a promising solution to these challenges. With a focus on equity, affordability, and access, it's poised to usher in transformative changes to our healthcare landscape. As we stand at the crossroads of change, the 2024 healthcare policy presents a promising solution to these challenges. So stick around as we delve deeper into the intricacies of this policy and unravel its implications for our health and well-being. Now let's turn our attention to the 2024 healthcare policy. A remarkable year, isn't it? Marked by key changes at both state and federal levels, the 2024 policy is a testament to our collective resilience and commitment to change. This policy is a comprehensive response to major concerns, such as access to care, mental health, the escalating cost of prescription drugs, and the much-anticipated Medicaid expansion. Let's break it down, shall we? To begin with, states like Texas are making commendable efforts to reduce the number of uninsured residents, while New York is focusing on consumer protection measures. These localized efforts, tailored to the specific needs of their communities, are an integral part of the broader healthcare reform. Speaking of broader reform, the federal government is taking significant strides to make healthcare more affordable and accessible. At the heart of these efforts lies a commitment to addressing social needs, expanding coverage, and ensuring that no one is left behind. This focus on equity and inclusivity is a refreshing and much-needed shift in our healthcare narrative. Additionally, the ongoing COVID-19 pandemic continues to shape healthcare policy. Efforts to reduce prescription drug costs and ensure widespread vaccination are being prioritized, reflecting our collective determination to overcome this global crisis. Reproductive rights have also emerged as a pivotal issue post-Roe v. Wade, with various states addressing abortion rights in their own ways. This highlights the growing recognition of reproductive healthcare as a fundamental right, a development that is set to have far-reaching implications. In essence, the 2024 healthcare policy represents an ambitious attempt to reshape our healthcare landscape. It's a bold step forward, an affirmation of our shared commitment to health and well-being, and a testament to our collective resilience in the face of adversity. So what does this mean for you? The 2024 healthcare policy is not just a document gathering dust on a policymaker's desk. Its implications are far-reaching, touching every corner of our society. The potential impact of this policy is immense, poised to revolutionize the way we approach healthcare in the United States. For starters, one of the key objectives of this policy is to reduce the number of uninsured residents. With states like Texas making efforts to expand coverage, the dream of universal healthcare is becoming more attainable. The policy is expected to bring significant relief to millions of Americans who have been living without insurance, bridging the gap between healthcare services and those who need them most. Additionally, this policy takes a hard look at prescription drug costs, a significant burden for many. With the Inflation Reduction Act allowing Medicare to negotiate prices for expensive prescription drugs, the policy aligns with past efforts to reduce drug costs. The ripple effects of this could mean more affordable medications for seniors and others dependent on prescription drugs. Improved access to care is another cornerstone of this policy. It aims to dismantle barriers to healthcare particularly for marginalized communities. By addressing social needs and expanding coverage, the policy endeavors to make healthcare more accessible to all, regardless of socioeconomic background. But it doesn't stop there. The policy also takes into account the ongoing challenges posed by the COVID-19 pandemic, with efforts to ensure widespread vaccination and bolster our defenses against future health crises. The 2024 healthcare policy, in essence, is about ensuring better healthcare for all. This is more than just a policy change, it's a societal shift towards a more inclusive and equitable healthcare system, and that's something that affects every single one of us. As we look to the future, it's clear that the healthcare policy landscape will continue to evolve. The ongoing COVID-19 pandemic has underscored the critical importance of robust, inclusive healthcare policies. Our resilience is being tested, but we're also witnessing an unprecedented opportunity for reform and innovation. The 2024 elections are poised to be a pivotal moment for healthcare policy. The dynamics of the race, coupled with the pressing healthcare needs of the nation, mean that healthcare issues are expected to take center stage. From access to care and mental health, to prescription drugs and Medicaid expansion, the stakes are high. But it's not just about the elections. The potential for further reform is on the horizon. We've seen how the Inflation Reduction Act has paved the way for Medicare to negotiate prices for expensive prescription drugs, a change set to take effect in 2026. This could be a game changer in making healthcare more affordable and accessible. The challenges are significant. Rising healthcare costs, disparities in access, and the ongoing impact of the pandemic are all elements that need to be addressed. But the progress we've witnessed in 2024 offers hope. The transformative changes and innovative solutions being introduced are steps towards a more sustainable and equitable healthcare system. It's an exciting, albeit challenging, time in the world of healthcare policy. And staying informed and engaged is more critical than ever. Understanding the intricacies of these policies, their implications, and the direction they're taking us in is key to navigating this complex terrain. Our healthcare system is a reflection of our shared values and commitments, and it's not just the policymakers or the healthcare professionals who shape it. You, as individuals and members of communities, have an important role to play. Your experiences, your insights, and your voices can influence the course of healthcare policy. The future of healthcare policy is a shared responsibility. Your voice matters.